Hey everybody, this is Dr. Michael Cuthbertson at Physio Fit. I'm going to show you how to correctly use a foam roller to loosen up your hips, to get them moving so that you can decrease your hip stiffness and minimize your back pain. We're going to address two areas with the foam roller today. Primarily, we're going to address the gluteal muscles on the back of the hip, our gluteus maximus, our hip rotator muscles, including the piriformis, and the outside of the hip, our TFL, tensor fascia lata muscle that attaches to the IT band, and our gluteus medius muscle. So go ahead and, while sitting down on the roller, place the side that we're targeting, ankle, on the top of the opposite leg. One common mistake that I see with foam rolling is that people will oftentimes try to create change in the tissues with the tissues in a slacked or loose state. We want to put them into a state of tension, in a taut state, so that we can make the biggest difference in these with the input into the nervous system. So in this position, go ahead and pull the leg toward you, and that's going to tighten up those muscles and tissues in the back of the hip. With it toward you, then you're going to start to roll up and down from the bottom of the pelvis toward the top of the pelvis, doing that at least 10 to 15 times. You can do that more. As you work on giving that input into those tissues and creating that state of relaxation, hydrating the tissues, making them more pliable and mobile, if you find an area that's a little bit more tense or taut or sensitive, put sustained pressure on that spot and then start to move the leg away and toward you, back and forth. Do that until you feel that area loosen up a little bit more. And make sure to do that on both sides. The next area that we're going to address, as I mentioned, is the side of the hip. So lie down on your side, use your hand to support you and your foot to support you. In this position, to put those tissues into a state of tension, you're going to lift up the bottom leg. That's going to tighten that up. You can also put a little bit of tension, more tension on there by leaning into the side here, toward the floor. As you do this, you're going to roll toward the top of the pelvis, and we're going to stay above that hip bone on the side. We call that the greater trochanter of the femur. And you're going to stay above that, rolling back and forth, up and down. You can lean forward a little bit more to target the TFL and do the same thing. The back side of it, we would target the gluteus medius. Again, rolling each position at least 10 to 15 times. If you find, again, an area that's a little bit tighter, you can put pressure on it, and then you can lift the leg up and down to work on that a little bit more. Again, remember that the key to these exercises is to put the tissues into a stretch state, work on it with the roller, kneading them out, giving input into them, and then allowing those to ease up, not forcing anything. The first several times that you do these, you're going to find that it's pretty sensitive. Fascial tissues can tighten up in as short as 1 to 3 days. So you're going to want to give consistent input into these tissues, doing it at least once a day. As you get used to it, as your body responds to it, you'll notice that it starts to actually feel good. It'll hurt, and then it might hurt good, and eventually you'll look forward to that, and it'll start to feel good. It'll allow your hips to loosen up, and it'll also take some of that stiffness and pressure out of the low back as well. The best time to do foam rolling is at the end of a workout. You've already got the system warmed up, the blood flowing through the tissues. And so to get the permanent changes that you're looking for to maintain a healthy back and a hip mobility is at the end of a workout. I appreciate you following along today. And remember, your potential is within reach.